What's going on, everybody? Welcome to the eAssist Dental Solutions Top Practice Podcast. I'm your host, John Stamper, and very excited to be coming to you today. So this video podcast / audio podcast is going to highlight some of the top practices in the country. We're going to spend some time with some of these amazing doctors, talk a little bit about their stories, some of the great things they're doing in their practice, a little bit about how they have worked with eAssist. And then we're also going to touch on some relevant information in regards to COVID-19 and what it's been like for a lot of these doctors to run their practices in the middle of this pandemic. So I'm very, very excited to have with us today Dr. Susan Mazzei from Naperville, Illinois. How you doing, Dr. Mazzei?
I'm doing great.
Awesome. Well, thanks so much for joining us. We're going to have some fun conversation here, and would love to have you get started a little bit about just yourself and where your practice is and some good things there.
Great. I'm as John said, I'm from Naperville, Illinois, and I'm originally from Michigan, and I went to University of Michigan for college and went to Northwestern University Dental School. Obviously for dental school. And then I completed a dental specialty program in prosthodontics at Northwestern. And then I taught there full time for 12 years. So I've been doing this a long time and love it, love every minute of it. But when I came out to Chicagoland area for dental school, I just stayed because I really love it. And I originally opened my first practice in Wheaton, Illinois, which is not far from here. And then it was a real small practice, less than 800 square feet. With a colleague of mine, Dr. Marco Fardo. It's great practice. And we were teaching at the dental school full time. So slowly we grew. And so it was an existing practice. We didn't start it from scratch. And we then moved to Warrenville, Illinois, when the dental school closed in 2000, I think. We actually moved in 2003. So we slowly grew. We were 2,200 square feet at that point, still 2 doctors. And then I just moved to Naperville 2 years ago and bought a building. So just keep on growing, having a good time.
I love it. So you mentioned that you stayed in the Chicago area after you went to school. Where are you originally from?
Michigan, Grosse Pointe, Michigan.
Okay, got it. Okay. And then let's talk a little bit about, I'm always curious if there was a time in history or you grew up with dentistry where you were like, dentistry is where I want to be. It's the profession that I want to get into. Was it a time? Was it something in particular that happened that really kind of sparked that interest?
Well, I think when I was in high school, I was very fortunate to come across a home ec teacher who created a dental assisting program in my high school at Grosse Pointe North. Her name is Jeannie Bossy. And a wonderful, dynamic person. And it was a college prep school, basically, and not a lot of tech programs. But she started a dental assisting program. And I wanted to go into healthcare. I knew I wanted to help people, and I really didn't know where. I have an uncle that's an orthopedic surgeon, so I'm very familiar with medicine, but I didn't want to be a physician. So she started this program. I can't really quite remember. I think when she presented it, it must have been so dynamic that was intrigued. I said, I want to do that. So we would start before school started, and she would have 2 hours of school. And I just fell in love with it. And I was a sophomore in high school. And I just never looked back. I never thought about it twice. I worked with she always, got me involved with other dentists in the area, and they knew I was interested in dentistry, and they taught me so many things. I was just fortunate every single step of the way that I met the most dynamic people, and I loved it. I really never, ever thought about doing anything else.
Yeah, I love that. And so the next thing I'm curious about is that, as you know, there's the clinical aspect of being a dentist. And then there's the whole aspect. You wake up one day and you're also a practice. You're an owner of a business. You're an entrepreneur. What has that been like for you? I mean, it's really cool. You talked about growing and as you've, expanded, over the years of your career, but what's it been like for you to be a practice leader and to be an owner of a business while at the same time, honing your craft as a clinician?
Yeah, it's definitely 2 different things. And as a dental assistant, I always worked in offices, and as a clinical professor at Northwestern. I worked at the dental school, but I have never worked in the other dental office as an employee. Mm-hmm. I've always started as an owner, which is a little unique.
Yeah.
So initially it was a lot of learning. I mean, my parents were always in business. So I learned about business, but you don't know it until you get into it. Right. Clinical part I have such passion for, so it's easy. I always say dentistry is easy. It's the other part of it that can be difficult at times, in that you have to just concentrate. And obviously as you grow, there's just layers and layers of whole other issues. You start with 2 doctors and no assistant, no hygienist, to now I have an associate, 4 hygienists, 4 assistants, 3 staff members, team members in the front. So it becomes like all of a sudden it just grows. And I think initially you think you can do it all. You want to just do it. You're doing the book, and you're doing everything, doing the number crunching. Mm-hmm. And you become, it's so personal that I think for me, it was very hard to let it go and let other people help me. It was hard for me to let other people in, because It's so personal. I mean, this is your baby when you grow it like this. Right. And trusting people to help you is hard. And I think one of the biggest things was recognizing that I needed other people.
Right.
I needed a bookkeeper. I needed an accountant. You need attorneys. Mm-hmm. And opening yourself up to learning. Like, I read all the time. So I just can't stop doing webinars, and it's just a constant thing. Yeah. But at some point you realize you cannot know everything. And that was the biggest eye-opening experience for me, because I got to a point that I thought, I'm either not going to do this anymore because I was getting burned out. I'm either getting out of dentistry, or I better do something different, because you just can't do it all when you grow like the rate we've grown. And I love private practice. I have no interest in selling to a management company. I just have zero interest in that. Yep. And that's another whole other, area of dentistry and the business part of it that's changed. Mm-hmm. And if one thing I can say is that if I could guide anybody in staying as an independent, mm-hmm. I think it's so important for the profession, and nothing wrong with management groups, nothing. Mm-hmm. Yep. But there's also room for us. Yep. And that's my big, I think that would be my big takeaway, learning to get help from other people and expanding, because you can't, I feel like Michael Jordan from Chicago. At some point you can be as good as you can be, but you can't succeed to the level you want to alone. You have to bring other people with you, and hopefully you find great team members. Like, I've been so fortunate. I've got a spectacular team, spectacular. And that is critical.
It's the quintessential Chicago analogy of every practice needs a Scottie Pippen, right? Everybody needs somebody, and I
could use a Steve Kerr though. Those 3-pointers.
Hey, that's right.
I gotta get them. I can get as many people as I can get. I'm bringing them in.
There's a lot of them, right? I mean, that documentary was awesome. I don't know if you watched The Last Dance, but it was so neat. I'm sure some, living in the Chicago area, to really understand, you guys were living in that, experiencing that. But to see that other side of it and all the people that they needed to make it work was pretty amazing. But, you bring up a good point, and I was going to ask you what, 2 to 3 of some of the challenges you've had. But I think you shared it right there. It really is that as a clinician, it's accepting that to grow a practice, to run a business, you need these other resources. And it really sounds like you found that ability to first let go of that, accept that. And then when you do that, wow, you can really grow. And I think the point that you made about the management companies, we're living in a time, as you know, Dr. Mazzei, where like years ago, there really didn't feel like there was as many resources for the independent dentist, right? You really did feel like you needed to do it on your own. Not so much anymore, right? Like, there's so many great resources out there and people that can help as you're looking to grow. And I think that's a good segue. I want to kind of get into a little bit about eAssist and how long you've been working with them in your team.
So we've been working with eAssist, which has been a spectacular experience, for a year, almost a year and a half, maybe a little less than a year and a half. I wish it was longer. I wish I did it earlier. But I didn't. But, everything happens like it's supposed to happen in life. Right. And it's one of those things, like, you just wake up one day and it's one of those things you realize I need expertise. You need someone else's expertise. And I'm very thankful that I found that group and the people. I mean, I only know the few people that I work with, and they're spectacular.
So I'm always curious about this. When a practice like yours is in a state, like you mentioned, of realizing that need, did you have any expectations at the beginning, or was it literally, once you learned about like the services that they offered and where you were like, listen, let's just get started and moving forward? Or did you have any expectations at the beginning, or what was that like?
I knew what I wanted it to be. Mm-hmm. And you don't know. Well, I'm the kind of person that I can't beat a dead horse. Just, you're going to jump in and do it. If it doesn't work, you do something else. I don't know. Right. I have many things I failed at. Right. I'm not afraid of failing. Sure. I'm not afraid of recognizing it and moving on. So I did a little bit of research, but it was one of those things. I just go with my instincts. I'm just like that kind of personality. And I just went in, and it met my expectations. I didn't even know. I knew what I needed it to do, but it has really surpassed that expectation. The partnership I have with them is just been great, really. We would not have made it through COVID. It would have been a struggle. I would have done it because I never give up. Right. Okay, I would have done it. There was no doubt. But they made it a lot easier, tremendously less stress. And it kept going through those, we were closed a little more than 2 months in Illinois, and not knowing. So, yeah. And they kept working. So that's the other thing. That was the huge benefit, because it's an outside resource, right? And they don't have to be here. Mm-hmm. So I used their whole group expertise while we weren't here, and they kept working. So, they communicate with us constantly. I'm always on. I'm always working. Like, we were closed, but I was here just about every day. Just deciding what we needed to be, who we wanted to be. This is what I told everybody. Who do you want to be on the other side of COVID? Yeah. What do you want to be? And I said every single day I woke up thinking, I'm going to do something and accomplish something every day, contributing to the office and my personal life. And that's what I did. So like when we were ready to go, they had really, we were all caught up. I didn't have to, it was not even backtracking, because the business end of that part of it, they did it.
Right. So you mentioned something really interesting that I'm curious about, is that you mentioned the acceptance that you had to come to as a clinician of bringing in other resources to help on the business side. As you know, the eAssist team works a lot with your team. And so talk a little bit about that, like how you were able to lead your team to working together with them, bringing on, like you mentioned, this outside company to manage a lot of the things that are internal processes. What was that like?
I think you have to build that trust factor initially, and they have to do it with us, and we have to do it with them. You have to, my team has to acknowledge that I agreed to do that with them. That was the first thing, explaining to them what it was. It was nothing about them. It wasn't a fear. No one's going to monopolize us. All right. They were going to partner with us. That's what it was about. So once I explained to them, everybody loves it. It's such a huge help. They might as well be in the office with us. This is how close, their relationship with the office. We communicate, we chat, we text back and forth. You have a question, you ask them, they answer back. Mm-hmm. We talk to them. I have meetings with them. If I wanted to meet with them every week, I'm fine. But it's building the trust, and that was important for the team. And they trust me to do the best I can and to bring in the best people. Right. Because we all want to succeed. I want everybody in this office to succeed. I want to succeed. I can't do it without them. And that's what we did. And that's it. We really I don't want to sit around and mash it up. Just get in and do it.
Yeah. So there's the emotional part, which you spoke to in regards to the value of that and what it's meant, and, through your leadership of all of that. How about some tangible benefits, right? I think there's a lot of aspects of bringing eAssist in, but what are some things, if you can think on the top of your mind, that really made like an impact, a detailed impact on the practice?
Okay, so you can have a lot of discussions about, on a minuscule level about coding, all right? And you can beat it around 100 times. And I use Charles Blair. I used it before, which is a very well recognized,
Yep.
The man is very well recognized and his group is. So I participated within his stuff. But how many things can you read? You have to go to someone who can pin it down, and you have to feel confident that they're going to give you an answer that's correct. So we have a discussion. The hygienists, they're worried about, perio coating can be a mess. Perio maintenance and all these it's ridiculous. Okay. And so we just ask them, and I just trust them, and that's what we agree to do. So on a very daily level, they help us get through even daily things like flora, which seems simple, but in the old scheme, we could have insurance sit around, pieces of paper sitting around because we can't make a firm decision, and we don't feel confident. Right. And so now you have to streamline it. I mean, I'm not a kind of person that says it has to be in order, this. I'm not. I want the end result to be correct. Everybody can kind of get there the same way as long as the end result is excellent. But you still need someone's expertise. So on a daily basis, we just correct it right then and there. It's not like, can I send them a letter and I'll wait a week and 2 weeks and maybe someone will respond with an email. It's instantaneous. You can't pay for that. You can't put a dollar figure on it.
Right.
We don't have any of these claims sitting around. Anything, a patient calls, we can just call them back and say it. And plus, I also am utilizing eAssist for the insurance billing, but also they talk to our patients. So patients will call them and they answer the phone like they're our office. They are directly part of our office, answer the phone with our office name, West Suburban Oral Healthcare. So patients don't think they're calling another country. They're calling here, speaking to someone who we have given approval for to speak on our behalf. And so right away, things can get solved. So if the patient calls us, because I've had this practice a long time, I know these families, this is a very tight group. Right. We don't do external marketing. These are all referrals. I go to their weddings and their grandkids, and I know the grandparents. And so they trust us. So I needed to find someone that I can have that level of trust. And we were able to do that, and everything is instantaneous. And that's you can't put a dollar figure on it.
Yeah.
I mean, the value. Patients need to value what we're doing. I need to value what the eAssist does for us, and it's tremendous.
So I've had the opportunity to speak with a lot of doctors in our profession. You're pretty awesome. You got great energy. Like I want to come into your practice right now. This has been super enjoyable. As you know, these last 3 to 4 months, everybody has pushed through in their own way, right? What would be something that you would share to your colleagues, your other practice owners, other dentists right now that may be going through some different challenges? I mean, you've had challenges, everybody's had challenges. There's no question. It's how you get through it. But, for those that may be really taking it to heart right now and struggling a little bit, what would you offer to them with kind of your experience with where you are right now?
And how to get through or keep going or what?
Yeah, I think how to, either how to keep going or just, from what you've learned from your experience of really kind of continuing to get through this and get to the other side of it.
Well, I say there's 2 aspects of it. There were initially when we met before we started working. One, I needed to make sure that my team was educated on what COVID is, what it is to their families, and what it is to our patients. So my team as an employees, I needed them to feel comfortable in our environment. So I did a PowerPoint. I mean, we talked about every ins and outs of it, and which is really important. We know this from psychology. I was a psych major in college. Everybody at the very, very minimum, you have to feel safe in your environment. Everybody, you cannot succeed and go to the next level unless everybody is at the level that they feel safe. Everybody seeks out safety. So we could not treat patients if the team didn't feel safe in our environment themselves, because they're worried about their families and their own health. So we had to educate them. I mean, I taught at the dental school. We went through AIDS. We went through no gloves. I've done it for a long time. So I knew that we could get past that because I just feel confident. But you have to do that. That's important. I've talked to many other colleagues. They have a hard time. Their teams have a hard time with that. People have lost team members because they can't do it. Well, I think first, everybody has to know you either are in or you're out. You either can do this or you can't do it anymore. after the team, then we have to know that we're healthcare providers. Dentistry is it's not an extra thing. It's a critical part of health. And that's my passion. So oral health, systemic health. We are here to help people, and patients will call us. Our patients want to be here because they know that we value their oral health like their systemic health. Yep. So we have not had a problem getting patients in. So I want to tell other dentists that we have a really important role in healthcare. We're not just working on teeth. Right. So past that. And I think that everybody has to remember that. And I think telling your team members that you value what we do, because we can't go on. We won't succeed past this if you first don't do that. So once your team feels safe, you have to let that go. One day on the meeting initially, I said, we're going to talk about COVID and what it is. Then now we're done with that. Now the next thing, do you guys have any questions? And everybody has to talk about how they felt going through the lockdown. I call it summer vacation. When we had summer vacation, what did you do? How did you feel? And you have to know how some people were scared. Some people didn't care. Some people have masks. Some people don't care. Some people are anti-vaxxers. Some people okay. So recognize that every single person here in this office is like the public.
Right.
And we have to accept and acknowledge each other for who we are and our concerns. Now we know that. Now patients, we have patients, they kind of have PTSD, some of these patients. Mm-hmm. So you have to recognize that and look at everybody individually and walk people through this, because that's our job. I mean, we're not just here. I'm just not here making money. That's incidental. And the business part of it. But the healthcare part of it, I'm very passionate. Obviously, you can hear it in my voice. Yeah. This is so important what we do. Our patients are here because they knew that their oral health, we know inflammation, COVID. I mean, here was our in. Actually, if I could tell dentists anything, yes. This was our opening. We are so fortunate because you talk about inflammation and COVID. I mean, all you have to do is open up every webinar. and patients know that. And that's it. You can get, if you understand it and you can educate patients, they're going to flock here because people want to take care of themselves at home, and we need to educate them on the way to do it. And that's our job. And we're not, that's what we do here. And I want to think that's why we're very successful, because my team knows it. I feel it. I want people to know that. And I will sit there all day. I just said, we just have a meeting. I am sick and tired of filling holes in teeth. If every single patient just came here and they had not one problem with their teeth, and I could talk to them about how to prevent it, that would be my day. It would be the best day ever.
Yeah. Well, so first off, I'm so glad that you mentioned this, what you called this opening, right, to dentistry, which I'm sure a lot of people are thinking about, like, what exactly she means by that. But I was going to ask you, it just feels like, and you can say firsthand that this awareness, right? Everybody was on, like you said, summer vacation or shut down. But this awareness through all of this was like, okay, maybe the thousands of conversations that you and your clinical team and the rest of your team have had with patients over the years, which is where you've always come from a healthcare perspective, like, this is important. It's important to take care of your mouth. And these are the reasons why, the oral systemic link. And yet we know, and you know, that in many cases I was like, yeah, we kind of take her seriously, but maybe it's a decision between getting a big screen TV or getting my perio work done, right? Like, they've always been in that situation. Now it just feels like, hopefully you guys are seeing this, is that this has been an eye-opening experience for patients to realize, number one, just how important their health is, because regardless of what's out there, whether it be a vaccine or a way to take care of it, someone's health is a big component of this. And as you know, Dr. Mazzei, in the oral cavity is where it all starts. And so I'm encouraged to hear that patients are coming to you. You said you've been busy as you've ever been. That's nice to hear. Very nice to hear.
Yeah. Oh, no, I just, this has been a journey, and my passion is, I'm also a functional medicine health coach. I think that lifestyle is a primary, and I'm not making it, I'm not creating this concept, but lifestyle is, if you improve that, we can get rid of 75% of chronic illnesses. And periodontal disease is a chronic illness. So that's just one facet. I mean, I think caries and causes, I think there's such a strong tie for everything. And I and our patients, I believe it. I'm passionate about it. So my patients believe me. You can't fake it. So I would never say, oh, Dennis, go sell this. No. If you don't believe it, there's where the value is. If I can't find what triggers the value, a patient values your services, then I can't tell them what to do. You just can't ever tell someone what to do. You have to find that trigger for them so they can realize. You need to pull them into your journey. They have to create. I'm not there to tell them what to do. I tell them, I can't fix it. I can't go home with them. It's no magic them coming to get their teeth cleaned every 6 months. This is magic. If they don't go home and do it, it doesn't matter. You might as well not come, ever. Yep. So, I think that my passion for it is they feel it and they come and they ask us questions. I have patients that come and ask me, I'm going to go see my physician. And what do you think? I wanted to ask you your opinion, because when I continuously learn. I want to educate my patients. I give them books. I want them to know that I think that's important to their health. Mm-hmm. I think that lifestyle, oral hygiene is lifestyle. Yep. If you're not a flosser, I'm not going to make you become a flosser. I have to find a way to do something, because you're not going to wake up and floss your teeth when you never did it your whole life. It just doesn't work like that. Right. You have to find how to change people, and everybody's different. So, there's so many ways. I wish I could obviously I could talk about this forever and kind of on a tangent, but I really love what I do, and I want to help people. And that's why we're successful, I think.
Well, it comes through. And I think as we close, I just had one last question, which was, through a lot of this, like you mentioned, were you able to take advantage of, I know eAssist has put together some webinars and some resources and things like that. I think there's a Facebook group, Dental Mastermind Facebook group, that kind of came out of this. Was there anything that you were able to take advantage of that you can speak to that was helpful during a lot of this transition, the shutdown, what have you?
I want to say I specifically can remember an eAssist webinar, but I did every webinar I could get my hands on. So I can't even tear it apart. Yeah. There was such great information out there that helped me. It makes you feel better that there was a way. And so there was a lot. And through it all, the women that I work with at eAssist, they were always in contact with me, sending me information if I needed any assistance. So I really never felt out of the loop. Right. I didn't. So I don't want to say it, because I know they did have a lot of stuff. And whenever I would click on things. Yep. But I don't know specifically. But there were a lot of avenues. Yeah. Thankfully. Awesome. I felt their presence, that they were there to help us through this. Mm-hmm. And that was important, because we have to work together. Yeah. I say there's never enough dentists. Everybody's always like, oh, there's 20 there. You have 100 dentists around you. How do you do it? There's just in Naperville, there's 140,000 people. Yes. What can you see? Yeah. We're not competing against each other. We're working together. Yeah. And I'm fortunate that I have a lot of colleagues and friends and eAssist, that we're a team, and we can bring everybody in. We can all prop each other up, and we can all be successful. Yeah.
Well, this has been awesome. Thank you so much. Again, I'm like you. We could sit here and talk for probably another hour on what you're passionate about and where dentistry fits into people's lives. And it sounds like, we talked about eAssist, obviously, and it's been something very, very beneficial for you guys. It's one piece of the puzzle of running a successful practice, and that's been great. Well, listen, I want to thank you so much for your time. This has been a lot of fun, and I wish you the best of luck as you continue on this massive journey that you have to educate patients in your community, and continue to be special. So thanks for your time today. I really appreciate it, Dr. Mazzei.
Thank you very much. I enjoyed speaking with you also.
All right. Take care.
Bye.